Okay, great. Well, good morning, everybody. Thank you for being here today and just giving us your time. We won't take up too much of it. My name's Amanda. This is Carrie. I'm a registered nurse for Excella. I work in the emergency department. I've been there 8 years. I was a paramedic prior to that. I've been doing emergency medicine since I was 16 years old. I'm now 34, so I've been doing it a pretty long time. We're both in school for our bachelor's in nursing. And so we're doing this through California University of Pennsylvania, just to give you kind of a teaching session.
And like she said, my name's Carrie. I'm a registered nurse at Shadyside Hospital in Pittsburgh. I work in the ICU. I've been there for 3 years.
So April is actually STD Awareness Month, part of the reason why we chose this. So we're here today to talk about STDs. If you guys want to look at your PowerPoints and just kind of go along. We brought a lot of informational packets for you. We're going to leave these here, so if people don't feel comfortable picking them up now, that's fine. I talked to Melissa and we're going to have them available to you. These are big packets that have a lot of the information on all the different types of STDs. And then I was able to get some condoms for you guys, so I'm going to leave these here as well.
Yeah, that other check.
Yeah. You can sit right here, buddy. This one's better, okay?
So there's different kinds, and then these are female condoms, which are pretty good barrier devices and protection for pregnancy and STDs. So little pictures on the back.
I'm sorry. I've never seen one of those before. Like,
Here, I'll go on for you, because I've only heard about them. It was prior to this that I didn't see them. So there's informational packets on, or pictures on the back. They're not the greatest. Okay. So that's kind of gross.
That's huge.
That is so weird.
Yeah. Okay. So, has anybody heard of the NuvaRing? It's birth control, and you insert it vaginally, and it sits over your cervix. This is kind of like the same concept. There's this ring. Now, I haven't used it. The girls at the Department of Health wanted me to try using it, and give them feedback on it. But my husband was not into that, so we haven't.
Yeah, I don't think I would.
So this is flexible, and you just insert it into your vagina, and then it kind of suctions onto the top of the cervix like this. And then basically it sits against the vaginal wall, and this hangs out, which is kind of gross.
Yeah.
But it gives you a good barrier protection, you know, if your partner has like HPV or herpes. Because it's actually covering, you know, the outside, like your labia. So that gives you good protection. Anybody want to play with it?
No.
I'll have a big kid back here. No,
I'm going to wash my hands. Because it's kind of gross.
Yeah, it's all lubed up now. It's all lubey. Good. Yeah, lubey hands. That was a bracelet there, Gary.
Yeah, they're kind of gross. They are really big. But I mean, you figure it has to like fit all the way through the vaginal canal up against the cervix.
Yeah.
You know, which is several inches, so. But those will be left here for you. Okay. So if you just want to follow along with your PowerPoints, today we decided to target the women and the men living in the homeless shelters. I'm sorry, I didn't know that there were men here as well, so I would have tailored this more to you as well. And there is a high rate of STDs and unwanted pregnancies, just because lack of resources, lack of funds. I mean, I'm sure no one here has a car, transportation. I know the bus station from here is several blocks away. I don't know where they pick up at, but they only run at certain hours. Not a lot of cabs in Greensburg. And then just because of different things like substance abuse, you're intoxicated, so you lose your inhibitions, and you're doing things you wouldn't typically do. Prostitution, rape, and then domestic abuse and assault. So today we're just here to talk about it, prevention and treatment of STDs, understanding the different types of birth control methods and pregnancy prevention, and then recognize your resources available. I'm just going to briefly talk about each one. There's more information in the packet, and then there's detailed information in these packets, and then all sorts of different packets about every STD. So to starting off with, you have your bacterial vaginosis, which is not technically an STD. It's just you get this abnormal bacteria in there, which basically overruns all the good bacteria. It is the most common infection in women of 15 to 44. And with all STDs, it's new sex partners, multiple sex partners, and douching, which I don't know anyone who really douches anymore. So don't douche. It's not good for you.
I do. I don't do it often, but I do.
Do you really?
Yes.
I'm a Norform girl.
I like
I like
Norform.
my Norforms.
Yes.
Okay.
Are they bad for you, Norforms?
What are
Like-
Nordic?
Yeah, I'm not sure what
It's
that
like a
is.
suppository, but it goes in the vagina instead of
Hold
in
the
your
gut
butt.
cover the walls like after. Yeah.
I've never even heard
I've
of
never
that.
They
heard
say
of
you
that.
can use it every single day. It's safe.
Yeah.
Yeah, it's like a little
Is it
suppository.
at like CVS or something?
Walmart.
I get mine.
No, I've
They
never
have,
heard
like,
of
different
that.
scents.
Yeah, they have scented ones, unscented, but
Yeah.
I like them. It's like an hour or so and it melts and it's
Right.
nice to pull all the walls of your.
Right.
And I like it better than.
Douchey.
Yeah. And they said it's safe to use every single day.
Oh.
Wow.
Yeah, it does.
No, I'll have to look into that.
Yeah, because I've never heard of
Because I use
that.
it all the time, so if you're telling me that's bad.
Well, the douching, it just, maybe the suppository wouldn't be as bad because it dissolves in there.
Right.
But so the douching actually goes in there and like washes it out. So you're washing everything out, including the good bacteria.
Right.
So it might be a little bit better than
Just take that one, Sarah Parker. He's gonna want you. That's where he wants.
the douching. But having BV or bacterial vaginosis does increase your risk for other STDs, just because it's getting rid of that good bacteria. So what good bacteria you have is not in there to help get rid of whatever you're exposed to. If you're pregnant, it can affect your fetus if you're not treated for it. And the symptoms of it are just like a white or gray vaginal discharge, odor, pain, itching, burning, and is treated with antibiotics, like most of them. Can be transferred between female sex partners as too, which everything can be, it doesn't matter if you're in a heterosexual or homosexual relationship, you can get it from either one. Chlamydia, really common. We see it a lot in the emergency room. Women come in with pelvic problems, and we see a lot of chlamydia and gonorrhea. So it affects both males and females, can cause permanent damage to the reproductive system. It can cause ectopic pregnancies, which is a surgical emergency. Spread by any kind of sex, anal, vaginal, oral sex. Can be passed to if you're pregnant to the baby, which most of them can. Causes preterm labor. Eye infections, that's the biggest thing. If you have a baby, you have it, and it's untreated, it can cause your baby to go blind. So if you're pregnant, you really, really want to be able to get treated for this and have it cleared up before you give birth.
So wait, what are the symptoms for chlamydia?
Symptoms is most people have no symptoms.
So it's like so basically you could just be walking around,
Exactly.
That's why it's so common.
Yeah, because people don't get treated for it because they don't know they have it. And so then if you have it and you don't know that, and you're having sex, and you're giving it to somebody else, and they don't know they're having sex with somebody else, and it's just getting spread to everybody. But you can have the abnormal vaginal discharge, burning with urination, and then if you are engaging in anal sex, you can have rectal pain, discharge, or bleeding from there. So, I mean, a lot of these symptoms are the same for each one. That's why you do need to be evaluated. You know, if you're a male, unfortunately, they're going to do a penile culture, you know, and stick the Q-tip down there.
Yeah, don't go into details.
If you're a female,
I feel all types of pain.
you're going to have a pelvic exam. They're going to take swabs. You know, they'll send them off for analysis, and then you'll be treated appropriately.
I try to go get treated. Like I try to go get tested every 6 months or so.
Yeah.
Yeah, that's really important to do.
It is.
Yes.
And it can lead to, which a lot of them can lead to pelvic inflammatory disease, which is, you know, permanent damages to your reproductive system. It is not considered an STD. You can get PID not from STDs, but it is caused a lot by STDs. So you really want to get it under control, just so you're not passing everything on, you know, and if you get pregnant, you're not causing problems for your baby. Next we have gonorrhea. It's also really common. We see a lot of it. That's the one referred to as the clap, which actually I couldn't figure out why it was called the clap.
Yeah, I thought chlamydia was supposed to be.
Yeah.
No, gonorrhea is the clap. So I did some research to find out why it was called the clap. And it didn't say for females, it was for men. It was back in the day when there were brothels and whatnot. So you get a really heavy discharge from gonorrhea. And it would be so heavy and thick that it would block the urethra in men. And so you couldn't pee. So a treatment was they would either distract you and like clap your penis really hard, or they said they would put it on a table and bang it with a
Piping.
yes, to break it up, and then you would be able to pee out the pus. So, yeah, it sounds awful. I'm not sure what they did back in the day to treat women for it, but that's how they treated the men. Yeah. So it's really common in the younger population, 15 to 24 years old. It can cause infection in the genitals, rectum, again if you're having anal sex, and the throat. So if you're doing oral sex, you know, and somebody has, a male has gonorrhea, you can get it in your throat.
Oh my god.
So it's really
I've never
important,
had
you know,
sex
if you
again.
have, exactly,
I'm
a
good.
sore throat, you know, or and if you look in your throat and you see pus and whatnot in your throat, a lot of people are like, oh, I have strep, you know, but if you're having oral sex, you need to be aware that you could also have an infection from gonorrhea in your throat,
Wow.
which again is pretty dangerous.
Yeah.
Oh my god.
It can also be passed to your baby during childbirth. Symptoms, men can be, here's another one, men can be asymptomatic. So we have a lot of women getting tested for STDs. My friend works at the community Department of Health down on Otterman Street, and she said they have a lot of women coming in for testing, a lot of women being treated. They don't have a lot of men. You know, so unfortunately with chlamydia and gonorrhea, you're not having symptoms, so if you're not having symptoms, men think they're okay. So they're not getting tested. You should be tested like every 6 months if you're not in a monogamous relationship. You really should. But you may have burning with urination, white, green, yellow, penile discharge, or painful swollen testicles. Symptoms for women may be mild, and they could be mistaken for like BV or a different STD. But you can have urinary burning, increased vaginal discharge, spotting or bleeding between periods. And then rectal symptoms would be like discharge, itching, soreness, bleeding, painful bowel movements. Which all of those symptoms can also be just from something as simple as hemorrhoids. But if you're having them and they're persistent, that's another reason for you to get checked out.
So the background's kind of jet because I got court.
Okay. So to diagnose that,
No.
here, you gotta stay out here, I'm sorry. Here, you gotta stay in here.
Millie,
They're staying
go
in.
play.
Your diagnosis, swabs, rectal, throat, vaginal, cervical. I work with a lot of doctors who we do pelvic exams, they swab people, and they do what's called the sniff test. I don't get that close to figure it out, but They smell the swab and they can diagnose from smelling it. We still send the culture, but you know, I mean, these are older doctors too, like in their 50s, 60s. They've been doing it a long time. They take a whiff, they know what it is, put you on the right antibiotic.
Wow. That's great.
So that's the treatment is antibiotics, and there are, if you've heard about like drug resistance, like your MRSAs, your VREs, there's strains of gonorrhea that are also becoming drug resistant. So if you go, you get checked out, you're diagnosed, you take your course of antibiotics, which you should, even if you're asymptomatic after like 5 days, you always need to complete that 7 or 10 day course. If you're still symptomatic after that,
No.
you have to be reevaluated. Because you might have one of those drug resistant strains that you need a different kind of antibiotic. And then no sex until you're 7 days out after taking the antibiotic. You have to wait to have sex. Untreated gonorrhea can again cause the pelvic inflammatory disease, and in men, untreated can cause men to go sterile. So if you're not treated, you know, and you have it, and you want to have kids someday, it can cause you to go sterile. So you don't want to put yourself in that position either. Next, we have genital herpes. It's hard to see on the PowerPoint, but I put on there the never-ending gift because it's the gift that keeps on giving. Herpes, HIV, HPV are viral. They're not bacterial. The ones that we have spoke about are bacterial. They're treated with antibiotics. These are viral. They never go away. You have them forever. You might not have symptoms, but then they can flare up and you can get it. So there's two types, herpes simplex type 1 and type 2. In the U.S., it affects 1 out of every 6 people ages 14 to 49. So it is pretty common. And here again, people don't know what it is. They don't know they have it. They're asymptomatic. You can be a carrier of it, never have an outbreak, and then you can be giving it to everyone that you have sex with.
So what you're saying is that 1 out of every 6 females in here got herpes.
Yes.
6 people.
And men.
Women,
Yeah, men and women.
Men and women.
There's only 2 guys in here, so.
Yeah.
And here again, you know, men a lot of times don't show symptoms. You know, if you're not having an outbreak and you don't have like sores or anything, you don't know. You're a carrier for it. Just skin to skin contact, just the friction of having sex, you can infect somebody else. And then if they don't have an outbreak right away, I mean, you can go years without an outbreak. I actually have a friend that got it when she was in her 20s, and it was devastating for her. You know, it was hard for her to tell people that she had it and to protect herself. The first, 2 years, she had it, constant outbreaks. She got it under control with medication. And then there's different, she takes niacin and lysine, which are over the counter. Those are supposed to help keep it under control. She takes those every day. She hasn't had an outbreak for 4 years, but she can also kind of feel when there's an outbreak going on or about to come on. So when she has those symptoms, she calls her gynecologist. They give her a prescription for acyclovir, which is an antiviral. She takes it for a week, and she hasn't had an outbreak since. But she can still give it to her husband, even though she is not having an outbreak. So unfortunately,
you don't have to have an outbreak.
right. So unfortunately, they're married. They've been in a monogamous relationship for 7 years. They have 2 children, but unless they're trying to have a baby, they always have protected sex.
Okay,
Because he doesn't want to get it.
I
Which
got
I
a question.
can't
So
blame
say
him.
somebody with herpes sits on a toilet or something, and then I go, you know what I mean? They're not bleeding or anything, but I go sit on that same toilet. Can I get herpes?
It's highly unlikely.
It's only through sex, right?
It's usually skin to skin
Skin to
contact.
skin,
Yeah.
So it has to be direct contact.
Okay. When you say skin to skin, so basically, if you just come up and just touch me like that, I can get herpes.
Well,
No, it has to be skin to skin contact with the area that
Area
has the
that
herpes.
has the herpes,
Yeah.
right.
I mean, you can spread it. If you're having an outbreak, and you have, say, sores on your penis, like blisters that are draining, and you go to the bathroom and you don't wash your hands, and then you scratch your eye,
You can.
you can get it in your eye.
Wow.
It's like somebody, if you have cold sores, which is a type of herpes, and, you're with a girl, and then you have oral sex, and she has cold sores, that can convert into the genital herpes. So that's really important that you're using a condom even for oral sex if you're having oral sex with someone that has oral herpes or cold sores.
Okay, so like, even if I don't have herpes and out of nowhere I get a cold sore, that's herpes. And if okay, hold on, where was I going with this? So basically,
So if I get a cold sore on my lip and I give you oral sex,
I'm gonna end up with real herpes.
You can, yes,
that's
vicious.
crazy.
yes.
That's crazy.
And condoms don't fully protect you against it because if you have sex and then you might not just have it internally or externally and then it can spread. So this is why the female condoms are good if you're having sex with somebody who has herpes, because they do cover the outer labia more so than a regular condom. So symptoms of it are the sores, blisters on and around the genitals, the rectum, mouth, and if you feel an outbreak coming on, it can cause like flu-like symptoms. You might just be fatigued, fever, body ache, swollen glands, and then some people will have kind of like a pins and needles or a tingling sensation down there, and that kind of, it's going to come on. So you can have reoccurrent outbreaks, you carry it forever, no cure for it, and it's treated with the antivirals, acyclovir, and Valtrex. And that's also how they treat like shingles, if anyone's heard of that. Because shingles is just, they're all strained kind of like the chickenpox virus. So it's really important. You might be embarrassed, but it's really important to let your sex partner know. And then there is a link between genital herpes and HIV. So you're at higher risk to contract HIV if you have herpes, because if you have an outbreak of herpes and you have those open sores or blisters, they're already open. So if you're having sex with somebody who's carrying the HIV virus, whether you know or not, that puts you at higher risk because you have those openings in the mucosa and in your skin. So definitely be aware of that. So then we have genital HPV, the human papillomavirus, which causes like genital warts, and it's the most common STD or STI in the United States. Here again, many people are asymptomatic from it. They don't know that they carry it. You have no idea that somebody has it. Some strains, all sexually active men and women at some point in your life probably have it, unless maybe you've been with one partner your entire life. A lot of times you can have it, and if it's not a strain that causes the warts, your cervix will just kind of slough it off. So if you get a pap smear, you might have abnormal cells. They can do a LEEP procedure or biopsy, take a better look at what those are, and then you might go back 6 months later for a repeat pap, and there's no evidence of it, which is good. That's really good. So it comes from all different kinds of sacs. It can go away, but it can cause the warts, which they say look like little tiny cauliflower areas. I've seen it really bad on some people. I had a man come in probably 2 years ago to the ER. He said he didn't know what was wrong. He was in his late 30s. He was actually there for depression. He wanted to sign a 201. Actually, after talking to him, he was depressed because his wife was filing divorce. They haven't had sex for years. I mean, here, when the PA went in to see him, which was another man, I mean, I've never seen anything like it. I mean, he was basically waist to thighs. It was, I mean, you could barely even tell he had a penis. It was that bad. It looked like big clumps of cauliflower all over him. I don't even know how he voided. He had insurance. I don't know why he never sought treatment for it or thought like, hey, this isn't normal. I think mostly he was just embarrassed. We did set him up with a surgeon who was going to like take him to the OR and laser them all off. They will probably grow back. He'll have it forever. But they can like laser them off in the OR. Now they do have a vaccine called Gardasil for the HPV because some types of HPV can cause cervical cancer.
Yeah, I had that.
The Gardasil. I had the Gardasil as well. It's a series of 3 shots.
Yeah.
You know, people are crazy about not wanting to vaccinate their kids. Or even my cousin said, I'm not getting that for my daughter. Her daughter's 16. She's not sexually active. But she's like, well, I think it'll promote her to have sex. I don't think it's going to promote her to have sex. I think that it's protecting her for the future.
What
Yeah.
ages can you start getting those at?
In the vaccine schedule now, when I just took my kids to the doctor, I think they're giving it at like 10.
Really?
Yeah. Because it's
Wow.
like, what, the first shot, and then 3 months later, the second shot,
Yes.
and then 6 months after that, I think, is the third shot.
Yeah, I think I'm gonna set my because she'll be 14. I think it's
Yeah.
Yeah.
about that time.
I definitely would. You know, it's not, I don't think it promotes sexual behavior or promiscuity, but if, you know, I think it's just going to protect them for the future.
Right.
Mhm.
Right.
You know, I mean,
now,
it's
you only
something,
have to get that one time, right?
Right.
And then you're protected for life.
yes. So routine pap smears is the best way for them to look at this. You know, once every year now, if you're not high risk, they're doing pap smears every 2 years. I just started that when I went for my last yearly appointment. My pap was normal. They called me back, hey, you have a normal pap. You know, you're monogamous, you're married, so we're not going to do a pap. It's your next yearly. It's every 2 years now.
Oh, okay.
Syphilis. You're not seeing a lot of it these days. Back in the day, it was a killer. That's what killed Al Capone, supposedly, was syphilis. It can cause long-term complications, including death. There's 3 stages: primary, secondary, latent, and late syphilis. It also causes sores, so direct contact through anal, vaginal, oral sex, and it can be passed from the mother to the unborn baby. You could have like a painless sore. It can just be a wound that you don't know what it's from. It's frequently misdiagnosed. You can get a rash that is not itchy, a generalized rash, which is a second stage, and you see it on your palms and the soles of your feet, or sometimes it can just be generalized. It can lead to preterm labor, delivery, and stillbirth. And then uninfected or infected, untreated babies, it can cause them cataracts, blindness, deafness, seizures, and even death. So it's another one that, here again, if you think you have it, you need to be tested. You do it right away. My first child, I ended up having a 3rd trimester fetal demise. It was pretty devastating, but they tested me for syphilis. And I didn't know why until afterwards when I was researching it. They just wanted to make sure because it causes stillbirth a lot of times. So I had another Weiss normal pregnancy, and then at 28 weeks went in for an ultrasound, and the baby had no heartbeat. So I got tested for syphilis, which I was negative, thank God. Otherwise I would have killed my husband. It's treated with an antibiotic, but if you've already had damage from it, it will not reverse any kind of permanent damage. And then trichomonas, which if you have a bad infection, I've seen it a lot in the ER. We do tons of pelvic exams. I feel like I work in a clinic sometimes, but you know, if you're having an infection, a lot of people can't get in to see their OB or GYN, or they don't have one. So they all come to the ER, which is fine. But if you have it that bad, I've done like cath urine samples on women, and you can actually hold the tube up and you'll see them swimming around.
Oh, really?
Wow.
Yeah,
Wait, what?
yeah, trick.
Yeah.
So I've seen urine samples where they have it so bad they're swimming around. And actually, I've seen it on a lot of really old women
Now
too.
I'm gonna look at my pee. Like every time I go to the bathroom.
Yeah, pee in a cup and hold it up to the light.
I mean, I know I don't
And
have it, but
you'll see what swimming? What
The trick, they're like
it's
little
like
protozoans.
Yeah.
So you'll actually see them. If you have it really bad, sometimes you can't see it. I've actually seen it on a lot of older women. I think, you know, who knows, like 70, 80-year-olds. They've probably had it chronically for 20 years and just never knew. Until they get sick and they come in and they're not acting right. And then we do a cath urine sample, and yeah, they have a UTI, but they also have trick. So it happens. It is the most common curable STD. In the U.S., 3.7 million people are infected. Only 30% are symptomatic, here again, and it's caused by a parasite, more common in older women. From anal vaginal sex, you could have no symptoms to just like mild urinary symptoms to severe inflammation. It could be intermittent, it may come and go, and painful intercourse is a symptom. So if you're never have painful intercourse and suddenly it hurts really bad when you're having sex, you could have trich. So you want to get checked out for that. It also increases your risk for HIV. There's a link between those. It can be passed to the baby, preterm labor, low birth weight, and the treatment is antibiotics. Again, so antibiotics for everything except your HIVs, your HPVs, your hepatitis, because those are all viral. And here again, very important to tell your partner so they know and they can get treated. Might suck to tell them, but you want to get them treated so somebody else doesn't get it.
Yeah, that's right.
Next, HIV. Everybody knows about something about HIV and AIDS. You know, HIV will eventually kill you. If AIDS, once it converts to AIDS, if AIDS doesn't kill you, the pneumonia or the subsequent infections that you get with it will kill you. You're more likely to get it if you have other STDs or STIs. 42% of people diagnosed with syphilis also have HIV, so there's a strong link there. You get it through all types of sex without condoms, multiple anonymous sex partners, increase the risk if you're having sex under the influence of drugs and alcohol because you lose your inhibitions, do things that you wouldn't typically do. It is viral. There's no cure. They're coming out with a lot of great treatments now that cause you to not go into AIDS. You still carry the virus. You can live a longer life, but again, there's no cure for HIV. And you take a ton of pills every day, and it's very, very costly. It is very costly. And there's assistance for it, but I know like some of that you can run up to $5,000 a month for these pills.
I have a caseworker.
Okay, that's fine, thank you. Yeah, we're going to leave these all here so you can take anything. So there's a larger increase among homeless people. Cannot be contact through casual contact. Sharing a drink with somebody can't be contracted through saliva. You can hug someone, you can have casual contact, but you got to be careful. The biggest thing to prevent STDs and STIs is know the facts of everything. Take control. Abstinence. I know that's really hard. We're all adults. Not a lot of people want to remain abstinent. Vaccinations to prevent it. You have your Gardasil for the HPV, hepatitis A, and hepatitis B. Monogamy. Reduce your number of sex partners. Use condoms, the male and the female, which again don't always protect you against genital herpes. Know your status and be tested regularly. Make sure your partner is treated and informed if you test positive for something. And then there is post-exposure prophylaxis for hepatitis A and B and HIV. So we see it a lot, again, in the ER. If somebody gets a needle stick from a patient, we will give them post-exposure medications. It'll make them sick, it'll make them miserable for a few weeks, but it's better to do that than to convert into a positive HIV. And then I have a bunch of resources listed here for you. We brought a lot of stuff for you to look over. This is this laminated one is from the Department of Health, and it's really good, and it has a lot of resources on it. Here in Greensburg, there is the Department of Health, which is not that far from the bus station. You can go down there, walk in, get tested and treated for free any day of the week. They'll do your swab for you if you need it. I didn't know some people are from Allegheny County. I put the health department number on there. There's a couple I put from New Canaan. Planned Parenthood is down on Route 30, past the mall by Barnes & Nobles, back in there by Burlington. There's where the Hallmark is. There's a Planned Parenthood there, and they're a great resource. The Department of Health. And then Excella has a free clinic but it's in Latrobe. It is not at the Greensburg Hospital. And there is a clinic down by the Stereo Shop in Greensburg called the Majesty Care Clinic. Free clinic for people, income-based. You can make an appointment there and get treated anytime. They just kind of have like strict policies. You know, if you miss more than 3 appointments, then they won't take you back because it's all free and everybody's donating their time. But there's a lot of great people down there. I know a lot of people that work there and volunteer there.
So I'm going to talk to you a little bit about pregnancy prevention. So obviously birth control kind of falls in 2 different ways. It's either the hormonal, where you're taking a birth control pill, getting a birth control shot, or a barrier method. There's also other methods such as sterilization, a vasectomy, getting your tubes tied. The withdrawal method, which of course is not effective at preventing pregnancy. Yeah. And then some people do, I know there's like people that measure their temperature every day, and that's considered natural family planning. Again, not effective at preventing pregnancy. So barrier methods. The only methods that are effective at preventing pregnancy and preventing STDs, again, are condoms. So certain barrier methods, such as spermicides, a diaphragm, and a cervical cap, which I think those are kind of like one and the same, which I think those are kind of more old-fashioned. I don't really hear of anyone using those anymore, but the diaphragms are inserted into the vagina, and then it kind of creates a cap over the cervix to prevent the sperm from entering the uterus. And then spermicides, there's the spermicide sponge, which also goes into the vagina. It's kind of a chemical that kills the sperm, so it doesn't enter the uterus. I don't really hear much of people using that, but I mean, those are barrier methods to preventing pregnancy, but again, those methods are not going to prevent STDs. These are obviously the male and the female condom are the only way of preventing STDs and pregnancy. And then hormonal methods, probably the most common is birth control pills. You take it every day. You want to make sure you're taking it at the same time every day, otherwise it is not effective. A lot of people I know set alarms on their phones, things like that, to make sure you're taking it at the same time. If you take it in the morning and then one day you're taking it at night, kind of is setting you up for failure, exactly.
I got pregnant on the pill for my first daughter.
Really?
Yes.
Were you taking it?
Yes.
I have heard of that. Which kind of can be a little bit scary for people that are taking the pill. They're doing everything
15.
right.
Oh, wow.
Really? So,
That's rough.
yeah, that is.
So that's why I say that I don't believe that pill works.
Yeah, I mean, they
I'm
do
not
say, I
talking
think
about
it's only like 98, 99% effective. I
And
think
I
they
just
do
had to be
use that.
Percent.
The 1%. Yeah, I mean, I've talked to people that have gotten pregnant on the pill as well, and just like you, they're taking it as they should.
And I did every morning, same time every morning.
An important thing to know about birth control pills is if you are, like, say you're taking antibiotics for strep throat or taking antibiotics for a UTI, those can interfere with your birth control pills, making them not effective. So that's something that people don't always know, and sometimes doctors, you know, if you're going to the ER and they're giving you an antibiotic, they might not even be aware that you're on the birth control pill, so that might be something that they're not telling you to be aware of. So if you are taking birth control pills and antibiotics, you want to make sure you're using a backup method such as a condom for that time frame that you're on the antibiotic to really protect yourself. And then there's also certain over-the-counter vitamins that can interfere with birth control pills, which I know St. John's wort is one of them, but I'm not really sure.
I don't know the other ones. The
But-
St. John's wort is a big one.
Yeah.
Which people take for depression.
It's like a natural method
Antidepressant.
antidepressant, which is a vitamin. I mean, you can go down to Walmart and buy it, but that can interfere with your birth control pills. And again, sometimes people are getting prescribed things, then they're not they don't even think to tell their doctor, like, oh, I take this vitamin every day. So that might not be something that they're able to talk to you about if they're not aware that you're on it. The patch, which I don't think is as common anymore, but you wear it for a month.
I had that before too.
Did you? Does
yeah,
it stay
I
on?
tried it. No,
It doesn't.
fell off.
Yeah, that's what I
Yeah.
would think.
Yes,
It
falls
wouldn't
off.
stay
It
on.
sucks.
Yeah, because I would think showering. It
Yeah.
would just.
Yeah, it falls off.
The shot, which you get every 3 months.
Mm-mm.
No.
You get fat.
Yeah, a lot of people
A lot
do
of
gain
people
weight.
do. Yeah, that's very common to gain about like 10 or so pounds when you start getting the shot. So a lot of times that is something that people choose not to get the shot because they want to avoid something like that. The NuvaRing, which it's in the news right now.
For increased blood clots.
Yeah, for increasing blood clots. But that's kind of like the flexible ring that you insert in your vagina.
Like
You
the
leave it in.
female condom.
Yeah.
You leave it in there for a month and then you take it out. You get your period and then you put a new one in. And then an implant, which would be like
Norplan or something.
There's a couple Norplant, Implanon.
The one I knew had like 5 little test tubes or something. in your
Yeah,
arm.
they
Oh,
put them
really?
in your upper arm.
Yeah, I've seen the little
I
like
thought about that.
instead of getting like an
IUD.
Yeah.
instead of getting an IUD, which is actually inserted into your or your cervix. I've seen people. It's like the chemical
Right.
IUD that goes in your arm.
Arm, yeah.
But then you can also get an IUD, which your doctor would insert in the office, and it's just a little thing that stays in your cervix, and it prevents you from pregnancy for 5 years.
What's the most common risk for that one?
I've heard of a lot of people have issues with IUDs, getting really bad cramps, still kind of having spotting.
See, I wanted to get that back whenever I had my last child, but I just said kind of tubes and stuff.
Yeah.
And I kind of regret it now. You know what I mean? Because
Yeah.
I was young when I did it.
Mhm.
Yeah.
So the hormonal birth control methods, those prevent pregnancy by they thin the lining of your uterus. So you're still releasing an egg every month, but instead of when you have sex, if the sperm would get to the egg, instead of it attaching to your uterus to cause a pregnancy, it just wouldn't attach because there would be nothing there for it attached to. So some people, if they're on birth control pills for long enough, they end up not getting a period anymore. And that's okay because your uterus walls are just so thin that you just don't get a period anymore.
I got a question real quick. I'm
Yeah,
sorry. I know you
that's
guys
okay.
remember. Say, you know, like I want to have a kid, but my wife is like, she got a tube tie or something. Like, what do I gotta do, you know, to break that barrier? That's not.
It's
I know that's like
Tubal reversal.
She would have to get surgery to reverse that surgery that she had.
And that's just if they were tied, right? I mean, that does not include if they weren't cut off or whatever.
I mean, they can fix it either way, but it's elective. So you're looking usually at like 10 to 15 grand.
And insurance don't pay for
And
stuff.
yeah, insurance doesn't pay for it, and then it only works like 70% of the time. It's
It's not a guaranteed.
not a guarantee.
Once you have the surgical way of preventing pregnancy, either the vasectomy or having your tubes tied, and years down the line, and you want to get that reversed, that's not a guaranteed thing that the reversal is going to work.
Yeah.
And like she said, insurance isn't going to cover it because it's
No,
an elective
no.
surgery.
It's like 15,000.
Yeah.
It's very.
Yeah, my friends tried to do it, and it didn't work.
Mm.
And they spent, it was like $17,000 they spent,
That
and
sucks so bad, man.
couldn't get pregnant.
Oh, that's sad.
It is.
So
It's a lot of money.
That is a lot of money.
it is a lot of money.
For it not to work.
Yeah, exactly. For it to
Yeah.
still be a chance. Of
That's
not
what I
working.
said. I'm like, that's a huge chance that it might not work. And they were willing to take the risk. So I don't think I would.
I don't think I would do it. I would have to save up a lifetime.
Exactly.
Yeah, I know. Nobody has just $15,000 laying
Laying
around that they
right.
can
Right.
spend on a surgery like that.
That may not work.
Exactly. And so then, I guess, if all else fails with these birth control methods, I mean, nobody's perfect. It's hard to use a condom every time. People have slip-ups. There is the morning after pill, which is over the counter now. You want to take that within 72 hours of having unprotected sex. However, the sooner you take it, the better. The sooner you take it after having unprotected sex, that's going to be a higher, more effective way of preventing the pregnancy. It is kept behind the counter at most pharmacies, so you just walk up to the pharmacy counter and ask for it. I know Planned Parenthood has it at a very discounted rate. I think it's like $50 if you would go to like CVS or Walmart's pharmacy, something like that.
It's
They told me it was like 100 or something.
No, it's 50.
And then I think
Yeah.
I'm not sure how much it is at Planned Parenthood, but I know they have it at a discounted rate there. As well as Planned Parenthood does offer free birth control. I'm not as familiar with the clinics in this area just because I'm from Pittsburgh, but I know the clinics in Pittsburgh offer free birth control. So, I mean, it's out there, it's available. I mean, why not? Exactly. Why not take advantage of it? So. And then, like we said, we're going to leave all this stuff here for you guys. Do you have any questions that we can answer?
You getting them all first?
No. Thank you for giving us your time.
Yeah, thank you.
Almost
Yeah, we're gonna leave everything here, so if you want to look at it, take stuff.
I do want some condoms.
Take them.
Yeah.
I want a female one. just
Well,
because
these
I wanna
are
play with it.
non-lubricated.